Good morning to the viewing and listening public. I am Government House Communications Director Richard Mota. We are here today to continue our efforts to provide the public with information concerning the administration's preparedness and response to the coronavirus, otherwise known as COVID-19. Today you will hear from the Department of Health Commissioner Justa Encarnacion, who will speak to the testing and other preparations that the Department of Health is leading, the Department of Human Services Commissioner Kimberly Causey-Gomez on measures being taken at the territory's elder care facilities, and VITEMA Director Daryl Jaschen, who will speak to the territory's readiness and response plans. We have also here with us to answer any questions regarding their respective agencies' response plans, the Adjutant General of the Territory, Brigadier General Kojo Knox Limbacher, VIPD Deputy Commissioner of Police Operations, Dr. Selvin G. Walwyn, and St. Croix District Chief of Police, Sidney Elsko. But before I turn the briefing over to the Department of Health, Governor Albert Bryan Jr. will address the territory. So at this time, join me in welcoming the Governor of the Virgin Islands of the United States, the Honorable Governor Albert Bryan Jr.
Good morning. I want to begin by thanking all of you for continuing to take common sense measures to protect yourselves against coronavirus and to provide an update on our response to the virus thus far. Since we began tracking the coronavirus in January, our primary concern has been to provide Virgin Islanders with the facts and the information they need to protect against this dangerous virus. A lot has transpired in the weeks and months since, and the spread of the coronavirus has come closer to home. Given what we know today about the coronavirus, our concerns are twofold. Our primary concern is our elderly population, as they are the most vulnerable to the effects of this virus. Secondly, we want to stay on the offense and constantly ahead of the disease by continually protecting the public from contracting the virus at all. As expected, over the last week, we have experienced an increase in the number of PUIs, or persons under investigation. At present, we have had 9 such individuals in the territory, of which 3 have been cleared as negative for the coronavirus. We are still awaiting test results on the remaining 6. And of those 6, only 1 has required us to have them hospitalized. As of today, we have no confirmed cases of coronavirus patients in the Virgin Islands. As of today, we have no confirmed cases of patients with coronavirus in the Virgin Islands, but we know that it is only a matter of time. We continue to urge the public to take necessary precautions against this crisis. Remain at home if you feel ill. If you believe that you have come in contact with the virus, please call 712-6299 or 776-1519. That's 712-6299 or 776-1519, and we will come to you. Please do not go to the hospitals unless instructed to do so, or you feel that your ailments have created an emergency situation where you need to do so. As reporting to hospitals unattended will create greater risk to others waiting for medical treatment in our emergency rooms. Constantly wash your hands thoroughly with soap and use hand sanitizer wherever possible. Stay away from people who are sick or may have come in contact with people who have the virus. Health officials around the country and here locally recommend social distancing as a strategy to mitigate against the spread of the virus. This includes people staying at least 6 feet away from each other and not attending large gatherings as a precaution against getting or contracting the virus. With this recommendation and the growing number of confirmed cases in the US and Caribbean, I am declaring a state of emergency in the US Virgin Islands. As of today, the Commissioner of Health, Justa, Encarnacion, has authority over all regulation of all healthcare facilities in the territory during this emergency. I have directed Commissioner Richard Evangelista of the Department of Licensing and Consumer Affairs to place a price freeze on all items that are in high demand as a direct result of this coronavirus pandemic. This declaration will also expedite the assistance of the federal government and give us access to more resources to help us minimize the impact of the crisis in our community. We must remain on the offense and do all that we can to stop the virus from crossing our borders and preempt any community spread in the territory. In keeping with this strategy, I am also placing a moratorium on permits for mass gatherings for the foreseeable future. After very careful consideration, extensive consultation with our local entities which are following regional and global developments closely and who have the most updated information about this threat, we have determined that it's best for the safety of our residents to cancel the St. Patrick's Day Parade for St. Croix this Saturday. This decision did not come easily, but as is the case around the world, the primary concern of government leaders is to make hard decisions and make those decisions that are in the best interest of the welfare of the people they have committed to protecting. The Centers for Disease Control and Prevention reports that many people at some point, either this year or next year, will get exposed to the virus. First and foremost, we must mitigate the possibility of this in our territory. We must remain vigilant and also take into consideration the status of our healthcare facilities that, while improving daily, are still compromised by the storms of 2017. While we are not stopping private citizens and activities at this point, we strongly discourage people from organizing and participating in mass gatherings, especially if they are elderly or are around elderly people. Individuals that serve as caregivers should avoid mass gatherings as they may become infected and transmit the virus to the most vulnerable, their loved ones who are over the age of 85. As another means of taking preemptive action, we are also restricting visitation at all of our elder care facilities. At this time, we do not see the immediate need to close public schools. We are currently preparing online and other alternatives should we need to close schools for any extended period. Our challenges in this regard are the availability of internet access and devices in every home. We are also very aware that many of our students depend on the school lunch program for a hot meal every day and take that into consideration as well. If we have a confirmed case and community spread, we will move swiftly to the next steps, which will most likely include school closures. We will be closely monitoring the situation and keeping the public updated daily and hourly if necessary. More information on the virus and local efforts can be found at doh.vi.gov. That's doh.vi.gov or cdc.gov. cdc.gov. There are also alerts to mobile devices, and those are available by texting COVID-19 USVI, COVID, COVID-19 USVI to 888-777. 888-777. We are urging radio stations and all media to keep Virgin Islanders informed by making available accurate information to their audiences immediately as it becomes available. We are also urging Virgin Islands, all in our Virgin Islands community, to pay attention to the official sources of information from the CDC, the Virgin Islands Department of Health, and VITEMA. This is a declaration of emergency, just like in the event of a hurricane, and we must work together to make sure that everyone is properly informed. These preemptive measures can have positive cascading effects, saving lives and preserving critical resources that your family will come to need in a month from now. To the business owners and vendors that are being affected, I assure you, this decision to cancel Saturday's parade was not made lightly, but out of the highest concern for the public's health, yours and that of our residents. We are counting on you to help us prevent a disastrous inundation of our hospitals and healthcare centers with people stricken from the virus. We continue to stress that 80% of all people infected with this virus do not need medical intervention. 15% require some medical assistance, and 5% need intensive services. While the majority of deaths have been in people over 85, we are all very vulnerable and should remain concerned and vigilant on this health crisis. Together, we can overcome this dark period in our history, as we have time and time again. This is a new challenge, but we are the same resilient people. This too shall pass. God bless you, and God bless the Virgin Islands.
Good morning. I'm Justa Encarnacion, Commissioner of the Virgin Islands Department of Health. I am in support of the declaration of state of emergency in response to COVID-19, disease caused by SARS-CoV-2. The step being taken at this time is not an immediate response to any case in the territory, of which there are none, but are being taken as preventative measures in order to be proactive and provide additional aid in the preparation of introduction and spread of this disease in the territory. Our mission as we work with partners is to mitigate the effects of the disease, and our number one priority at this time to do everything possible to reduce morbidity and mortality, death and illness from COVID-19 disease. Since the beginning of this outbreak in January, we have been working in close collaboration with Tourism, Port Authority, Border Protection, Customs, EMS, Fire, VITEMA, Maritime, Coast Guard, both our hospitals, property procurement, federally qualified health centers, and private healthcare entities. As the lead agency in this outbreak response, our priority at this time is surveillance, to detect when and if this virus comes to the United States Virgin Islands, contact tracing, quarantine, and containment and mitigation efforts to protect those that are most vulnerable, the elderly and immune compromised. You will hear more about what the Department of Human Services will be doing to protect our most vulnerable in reference to the youngest population, as well as the oldest in our population. Given their congregate nature and residents served, example, older adults, often with underlying chronic medical conditions, nursing home populations are at the highest risk of being affected by COVID-19, as the governor stated. If infected with SARS-CoV-19, the virus that causes COVID-19, residents are at increased risk of serious illness. There have been a large number of questions regarding testing. Our public health lab, located on St. Croix, has been given approval for testing. We have received all but one component of the testing kit. That item is expected any day now. Once the kits are verified, we have the capability of testing up to 1,000 tests, or conducting up to 1,000 tests. As the science changes surrounding the research of COVID-19, more options will become available to us. We are also in discussion with local labs and national labs to conduct tests. The territory is working on procuring the additional supplies of sample kits as well. The action taken by Governor Bryan allows for expediting requests made to the federal government. DOH has been in contact with the Strategic National Stockpile, and they are working on securing the items needed. Private practitioners, the Department of Health is dependent on you to help by recognizing the symptoms, notifying Department of Health, and collecting the samples if the supplies are available. Triage for flu symptoms, and provide masks. Separate if space is available. Call the Department of Health if you don't have the supplies to collect a swab, and we will assist you in arranging for tests. Again, our numbers are 340-712-6299 or 340-776-1519. I repeat, 340-712-6299 or 776-1519. We ask that you use practical measures in ensuring that you remain safe and that you keep the others around you safe. The Department of Health will continue to monitor the pandemic and update the public. Thank you.
Good morning. I'm Kimberly Causey-Gomez, Commissioner for the Virgin Islands Department of Human Services. I'm here to update you on our collaborative efforts with our partner agencies and to ensure you that DHS is taking the necessary and urgent universal precautions as it relates to COVID-19 in our most vulnerable populations. As stated by Commissioner Encarnacion, given the congregate nature and residents served, and nursing home populations are the highest risks of being affected by COVID-19. If affected, residents are increased risk of serious illness. It is with an abundance of caution, and in order to keep our clients and staff safe, the Department of Human Services is enacting the following measures. Effective today, the Department of Human Services senior centers located in Estate Richmond on St. Croix, Newt Hansen Complex in St. Thomas, and Cruz Bay in St. John will be closed. The Department of Human Services Senior Citizens team will ensure daily communication with each client we serve at the centers, as well as we will deliver meals as needed. Queen Louise Home for the Aged in St. Thomas and Herbert Grigg Home for the Aged in St. Croix will cease all visitation by groups, family, friends, clergy, etc. A meeting will be held in both districts next week to answer any question family members may have regarding COVID-19 and their relatives. They will be contacted directly with the details by our staff, and we are working on alternative ways for our residents to stay in contact with their loved ones. In addition, the Division of Senior Citizen Affairs is also temporarily postponing the distribution of senior ID cards in both districts. Our VI statutory home-based and outreach social services will continue at this time. Our staff are urged to adhere to all health and universal safety precautions. The Head Start program classrooms at this time will remain open. We are strongly encouraging staff as well as parents with children who are ill to stay home to prevent the spread of germs. As stated right now, we have no reports for child care centers or providers to be closed. In the event that that happens, we'll make sure that we update you as needed. Act number 8058 was established for Department of Human Services to establish a registry for persons 60 years old and older living alone or individuals with disabilities that may be in need of emergency assistance during a man-made or natural disaster. If this pertains to you, please call one of our DHS offices at 774-0930 extension 4018. On St. Croix, 773-6630. On St. John, 776-6334 for more information or to voluntarily register. DHS continues to receive guidance for best practices from our federal partners and will continue to monitor the situation. Information will be updated as it becomes available. Again, these measures are being taken in order to protect the health and safety of our clients we serve in the territory and mitigate the spread of infection. Thank you, and I'll be happy to answer questions at the appropriate time. Director Jaschen.
Good morning. I'm Director Daryl Jaschen, the Virgin Islands Territory Emergency Management Agency. For the last 7 weeks, Department of Health, VITEMA, Human Services, National Guard, messaging, we've been working with local, regional, and national level for information. Things have moved very, very quickly. Part of the last couple of weeks, we've stood up the Department of Health Emergency Operations Center on St. Croix and St. Thomas. They've been a lead agency, doing a wonderful job. Based upon the Governor's declaration of emergency, we'll be standing up the full VITEMA Emergency Operations Center, which is already pre-identified for 23 agencies to coordinate with, to include our federal partners. One of our key federal partners has been working with the U.S. Coast Guard. The U.S. Coast Guard has been involved since day one with the maritime information and scheduling as far as any cruise ships coming into the territory. And we'll continue to have discussions with them. Additionally, historically, we've already run one tabletop exercise, and we have in the future a couple more exercises to include a rehearsal concept operations exercise on Monday afternoon in order to make sure we have tight control between patient movement, the hospitals, and even if we need to do an aeromedical evacuation. So more information will come out from the territory, but we stand ready to respond to any needs the territory may have. Thank you very much.
Thank you, Director Jaschen. At this time, we will open the floor for any questions from the media.
Good morning, Susan Ellis with The Source. For Commissioner Encarnacion, can you tell us a little bit about the test kits and what's in them? How do you use them? Where will they be stored? Who will get them? How many do you expect for us to receive?
Okay, so we're expecting 1,000, the availability to conduct up to 1,000 tests. And then, of course, as we conduct tests, we will be requesting to have those supplies replenished. What exactly is in the test kit? That's scientific for me to actually explain to you the details within the kits. But what is important to note is that they will be able to provide accurate information once the sample is presented to the Department of Health's Public Health Lab.
And how long do you think the testing will take before results are known?
Once we are able to conduct the test on island within 24 hours.
And when do you anticipate that we'll be receiving these test kits? Is it like a swab kind of thing?
There's a difference between sampling and test kits. The swab has to do with the sampling. The actual test kits itself is actually what the laboratory holds to conduct the tests. So we have swabs within the territory, and we have the major portion of the test kit waiting for one section to come, and we're expecting that to return to us or come to us any day now.
Okay, thank you.
Thank you. Good morning. My name is Gilbert VI Consortium. Governor, you clearly stated that you're banning large gatherings, and you mentioned, of course, tomorrow's gathering, which will be canceled, the St. Patrick's Day Parade. You did not mention, of course, VI Carnival and your decision there. Can you explain?
So we haven't made a decision on Carnival as yet. We want to see what happens this week before we actually cancel Carnival. And I want to be clear, what we said is that we're not issuing permits for large gatherings. So if you have a gathering where you don't need a police permit, we're discouraging people from doing that, but we're certainly not banning them at this time. What we want to make sure is that as a government, we're not facilitating large gatherings of people. We clearly anticipate that there will be people coming to town and participating in festivities and maybe occasioning restaurants and taverns, but we don't want to encourage the public to attend mass gatherings like parades. So right now, we're looking to see what happens in the U.S. When we look at the infection rate in the U.S., it does seem to have a downward curve, which is kind of contradictory with the information that you're hearing on the news and that is being delivered to us. But we also know that whatever happens in the U.S., we're usually delayed. So if their peak was a couple weeks ago, we expect to feel our peak a couple weeks preceding. And then as they tone down, then we could wait a couple weeks and when we will see us tone down too. So we're remaining vigilant on this. We don't want to cancel these events, but as I said, the public safety is of the utmost priority.
You said you're looking at the entire week, so by, say, next week or next weekend or so. When do you think you'll have a decision on, well, people are buying tickets, Governor?
Two things are going to make that determination. Number one, how quickly we have a positive in the Virgin Islands. We don't have any yet. And the second thing will be is if there's any community spread. But I could tell you right now how we're projecting more than likely Carnival will be canceled.
Okay. Governor, you mentioned, of course, UVI decided it's going to have classes remotely. Mm-hmm. So too as Montessori School. You mentioned the government is not doing that as of yet. Obviously, there are some challenges as it relates to kids at home and access to internet and the government's own ability to provide remote learning. If we indeed get to that point, what are your plans for remote learning? Well,
the Education Department has already contacted a vendor that is able to provide the curriculum for remote learning. One of the things that we constantly want to reiterate is that what the United States government strategy is just to spread out the peaking of this virus. We don't want everybody going to the hospital and getting sick at the same time. So our efforts will follow those. Our concern around the children is it just spreading faster and them taking it home to their elderly patients. As I mentioned, most people within this year or next year will come in contact with this virus. It's our new reality. Once again, 80% of the people do not have or need medical attention. This is a small group, really a window of people with respiratory illnesses, people who are over the age of 85, people who may have been smoking or have some other complication with their health and their immune systems. That's our target group that we're really, really trying to protect right now.
All right, Governor, thank you. I think this...
Thank you. Susan Ellis again with The Source. I'm wondering about nationally what kind of data we're receiving and from who regarding the updates of the cases nationally, and whether we will get FEMA involved as the delegate was recommended to do yesterday. I guess there's a March 20th deadline for FEMA applications. Will we be doing anything to try to get their assistance?
We have an active conversation with FEMA. One of the things that I realize about the new media scene is that people use all kinds of media to stay in contact. We have been trying to hit all of those: radio, newspaper, TV, social media. But still people are saying they're not getting information. So we're trying to get out as much information as possible. As far back as mid-February and January, we've been having press conferences to tell people about the coronavirus. We've been having conversations with VITEMA, with FEMA. We have a regular Friday call with over 100 individuals. That is a normal practice before now with people discussing it. We've been out to healthcare providers, school nurses, practitioners, telling them about what was coming and how to prepare for the virus. We have a Monday call every Monday at 12 with Vice President Pence, where we get a briefing for all the governors in the union. So we have an active conversation with all our federal partners, our epidemiologists, I know I'm going to get that word wrong, and our health commissioner, have an active conversation with CDC, are talking all the time. We realized that we had to be ahead of this virus because, unlike other places, we have a large government portion of our population, and if we get incapacitated, we don't have subs to come off the bench and fill some of these spots. So what we're trying to do is be preemptive as possible to make sure that we conserve our resources, that we keep the amount of people who are going to get sick down to a minimum, and that we focus in on the elder population, which has been the most vulnerable to this. Young children have a very good resistance to this particular virus. And our main concern around the schools is them transmitting and carrying the virus to older individuals.
But are you getting up-to-date information nationally from CDC or whoever has as the cases are being reported and
Absolutely.
tested?
We're getting the most up-to-date information as possible. CDC.gov, I would like to say, is a very good source of information. The information is now being updated almost hourly. On your website, you can go on there. It has very concrete information about the virus, how to contain the spread, and what you can do at home to protect yourself and your family.
And are we doing anything to monitor cruise ship passengers or
cruise ships?
People?
I actually went to Miami. I issued several press statements on this as well. Thank you for that question. I sat with the president of Carnival as well as individuals from Royal Caribbean to discuss cruise entry into our ports. At this point, they are using extreme caution. The other day, we had a ship that there were 3 crew members that were in an airport in Asia, in Japan, for 4 hours, and we refused them entry into our ports. So we are not making this public. We consider the cruise ships are very close partners. We have a symbiotic relationship that allows for economic dollars to come to our islands, but they have submitted a protocol to the president on what they are doing about people getting on their ships. There's a 2-tier passenger screening system to make sure that people are not getting on the ship with those viruses, and then they're keeping their crews isolated in order to stop any spread of the virus. Like I said, it's of extreme caution where the cruise ships are involved. We've also sat down with some of our airline providers to talk to them about what they're doing. Coming to the Virgin Islands, they're supposed to be asking you, or anywhere else, have you been to mainland China, Italy, Iran? We really appreciate the efforts of our partner, our brothers and sisters over there in the British Virgin Islands. They have also instituted a ban now on travel, and people traveling to BVI may be subject to a 14-day quarantine if you have been in contact with or places that have the virus. That is really good for us because that was one of our borders that I was very concerned about.
Just one more question. The people that are under, not investigation, people of interest that have suspicions of perhaps contracting the COVID. Yeah. Where are they? Are they in the hospital? Are they on St. Croix? Are they on St. Thomas? And if someone suspects they might have it now, what do they do about it?
We have people under investigation on both islands. Only one person, as I said, is quarantined to the hospital. The others are self-quarantined in their residence. So people listening to the public's concern about this on the radio, or people calling in, there seems to be a misconception about quarantining. Only if you need medical attention do you need to be quarantined at the hospital. If you feel ill, quarantine yourself in your own home. Refrain from going out. Refrain from having your kids and people who have been in contact with you from going out. If you look on cdc.gov and also on our website, doh.vi.gov, there are things there that will tell you what to look for if you have the virus. It is characterized by a very high fever and a dry cough. It's regularly not associated with a runny nose, and you will have respiratory problems. One One test is to hold your breath for 10 seconds and see if you have problems breathing, if you're coughing. That'll tell you if you have the virus. If you don't need to go to the emergency room, just like you have the flu, stay in place. And you can contact our Department of Health so we can keep an accurate account of people who may be experiencing this. But this is something that is going to visit our shores no matter what we do. All we can do is control the spread and the transmission, and so far we have been doing a great job on that. And that's not only because of us, it's because of people like you making sure that they're taking the precautions and staying safe as possible.
Yes, Governor, a few more questions. I know the last time we had the press conference here, the Department of Health said there was a fourth test that was supposed to return. Do we have the result?
We are still waiting for that test to come back.
Okay. So in relation to the length of time, there is no set time, is there?
Well, there is no set time. Right now, as the Commissioner of Health was saying, we are setting up our own labs. We've already been approved, and certainly by next week, we expect to have the capability to turn around testing within 24 hours, but right now we have to rely on the CDC as we send our test results away. And then those are actually prioritized, because if it's not a high likelihood that this person has the virus, then they don't prioritize the testing. So we're looking at that as well.
Thank you, Governor. In relation to sporting events, there's little leagues going on, different games. Are those events categorized in your dissuading of large gatherings? They are, but we don't consider the Little League tournament this weekend a particularly large gathering, and as it's centered around children, we have decided to let that tournament go and play, continue as scheduled. We will continue to monitor events as they come up bit by bit, but like I said, our concern is larger events with people in very close proximity. Unfortunately, our Little League events are not well attended, so we have allowed that to go on. So, Governor, a few more questions relative to you've been traveling, of course. You've gone to Florida recently. We've seen certain leaders and even some Congress people fall ill to the coronavirus. What precautions is your team, or does your team have in place for you and, as you travel about the place? Our Commissioner of Labor, Gary Malloy, who is in control of OSHA, has issued some protocols regarding people in the workplace for our government workers who are coming into contact with individuals, as well as traveling. I am not that squeamish when it comes to health concerns such as this. I just try to keep my hands washed and keep them sanitized as much as possible. In traveling through the airports, I was in Miami as well as Atlanta this week. You can see the obvious downturn in air travel. When you travel, some people are wearing masks, but for the most part, the people who are traveling now are experienced travelers and are not as frigid or timid about the coronavirus. So what we're trying to do as a cabinet, we're trying to limit our travel as much as possible, not so much because of transmission, because we want to have every single resource available to us in the territory should we have a surge of any kind. All right, Governor, and what exactly is the government doing with respect to cruise support industries, taxi drivers, merchants in Havenside, Crown Bay, waterfront? Well, that's more of an education, as we are doing here, trying to share information about how to use hand sanitizers and how to keep yourself safe. It is my estimation that the cruise passengers will probably be some of the cleanest people because of the amount of precaution and what we had. So far, what we've had in the past with our ships being quarantined and out to sea. So far, we've had 15 cancellations of cruise travel to the Virgin Islands. It looks like most of the cruise ships now are suspending activities to at least the end of March. Princess has totally canceled their cruise travel as well. They're offering people very flexible rescheduling opportunities. So we continue to monitor that situation as well. Okay, and I had something for DOH here. Of course, you mentioned, thank you, Governor. Of course, you mentioned the amount of tests that will be able to be conducted. can private doctors or clinics test as well? Do they have approved test kits?
They would not be able to test, but they would be able to conduct the samples so that we can actually send the test off. Once we actually have approved review of our test kits by our lab director, Dr. Brett Ellis, then we'll be able to conduct the test here, and then they will be able to send the samples to us.
Commissioner, I think you need to explain to them that if people think you're getting test kits to the hospital, not to the labs.
So there's a difference between sampling and testing. Sampling is actually when you take a sample. We spoke about nasopharyngeal and oropharyngeal testing. That's when you actually take a swab, like a Q-tip swab, but a very long swab, and you actually take samples from the back of your throat, the back of your nose. That's actually the sample. The test kits is what you actually utilize the sample. It's put on a medium, and that is actually how the test is actually conducted in the lab. That's the test kit. That's the difference between both.
Okay, thank you.
I wanted to reiterate the numbers I would ask for before. In order to contact the Department of Health, we have two numbers, 340-712-6299. I repeat, 340-712-6299, 340-776-1519, sorry, 340-776-1519.
Okay, I have two additional questions.
Excuse me. Sorry, Ernest, we'll just take one more question. We're running down on time, so we have some other obligations. So we have one more question.
Governor, relative to, I don't see a Department of Education, of course, rep there, but of course you're doing your job with that. We've been getting questions about adequate hygiene products at the schools. You haven't decided to, do nothing different with the public schools yet. Do you know if we have adequate, say soaps in place and whatnot so that students and teachers could take the precautionary measures?
Department of Education has been taking a lot of measures to make sure that we have those things available. We will certainly be circling back with them to make sure that the schools are equipped with the adequate hygiene and sanitizers to make sure. I myself ordered 200 bottles of hand sanitizer that we plan to keep and give out to people just to make sure that we're promoting all the time to keep safe and make sure you elbow bump.
All right, Gov, this is the last one, and it's going right back to what we said about your announcement about the carnival. We've been getting a lot of messages here, and people are saying, why didn't you just go ahead, since you canceled St. Patrick's, seeing what happened in the States with NBA, NACP, everywhere, events, Afro Nation, canceling all over the place. Why didn't you just go ahead and make that announcement? Thank you.
Well, like I said, I mean, we're going to wait and see. If people if you don't want to go to Carnival, you have the ability not to go to. You don't need me to cancel for you not to go. But we'll definitely be looking at that as things progress. I mean, we have to make concerted decisions. Before I go, I want to say this. The economic impact of this on our community is going to be long felt, and it's going to be hard. Right away, the president is looking to delay the April 15 deadline. That immediately affects the cash flow to the Virgin Islands government. The cruise ships have stopped coming, which affects our tourism dollars. Flights are down. So far, we've been holding steady on hotel reservations. But this is of grave concern to a tourism economy like ours. There's no indication at this point how long this is going to last. So we're doing the things on the government side now to reduce spending and look at a conservative approach of moving forward, because we have some very rough days ahead, not only health-wise, but economically. How are we going to do the things that we are obligated to do by our budget, and how do we get those revenues in? How do we make sure that all these people who are going to have to work overtime now to handle this situation in our community remain paid? And how do all those people in the private sector who are working for businesses that are impacted heavily by this downturn in tourism make out? Those are conversations we are having all the time. And we assure the public that we're looking to every which way for relief for our territory as we move forward. As I said before, our most concern is a large elderly population that we have here in the Virgin Islands. So we're just asking people to be vigilant and be safe. God bless you, and thank you for coming in today. Have a great day.